Hello, I'm Ed Mullen, Technical Solutions Director at Nava, and today I'm excited to tell you more about OSCER, our open source community engagement reporting tool. As Rohan said, over the last 10 years, we've worked with over a dozen federal agencies and a dozen states. As he shared, we've had a lot of impact. Those enrolling 50 million households in various health and economic programs, analyzing billions of Medicare claims, and saving decades of labor hours for caseworkers and adjudicators. We've seen a lot. We've seen digital government service problems from every angle. We've seen agency administrators proudly report to their legislatures about projects that are ahead of schedule or have high user satisfaction. And we've been there to help agencies pick up the pieces after things have gone wrong. We've been on the ground with caseworkers who have proudly shown off their tabbed binders with workarounds and how-tos that help them navigate their aging technology to serve their beneficiaries. And we've heard their relief when a burdensome task is made easier or automated away, allowing them to focus on more high-impact activities. We've sat with applicants and watched as they struggled to navigate overly complex applications. And we've heard them express relief when a service that they were dreading turned out to be a smooth experience. We've talked to call center workers and program administrators, talk about high call volumes and long wait times. And we've seen how the right tools can change that strain. And we've worked with federal agencies, pushing states to make changes through a mix of carrots and sticks. And we've worked with state agencies struggling with the complex requirements of federated programs. In all these scenarios, there is a common thread. Government staff who show up day after day to support their neighbors who turn to the government for support when they need it most. We've seen a lot, and we know the forces at play and where those forces lead to cracks. And today, we find ourselves in a moment of profound change. HR 1 has introduced new community engagement requirements that will change the process of applying for Medicaid, the activities for beneficiaries to maintain their coverage, and the work of state staff and state systems. People applying for or receiving Medicaid will now be required to have either $580 in income a month or engage in 80 hours of community engagement to retain coverage. Community engagement means work, education, volunteering, or a number of other qualified activities. States will choose the reporting cadence within certain allowable ranges, and there are a variety of exemptions with from the requirement that will require their own navigation. States are currently scrambling to determine how they can best become compliant within the narrow time frame to support people who are applying or trying to maintain their coverage. State systems will need to integrate new processes, business rules, workflows, data checks, and notifications to enact the new rules. State staff will need to learn new processes and tasks that risk creating backlogs if not done right. At the same time, agencies are also addressing HR 1 challenges related to SNAP. We've spoken with many states who are navigating the new realities of HR 1, and there's a lot of uncertainty. And it's not surprising. They know the realities on the ground in their states. When big changes like this have happened in the past, we've seen states mobilize to rise to the challenge only to be met by big vendors selling solutions they claim to be complete, yet require years of rework. These vendors have touted nationwide experience, but they don't mention their poor track record. Then when they get called out, they blame civil servants for their own shortcomings. We should be in better shape than we are. Over the last 15 years, billions have been invested in modernizing Medicaid through a succession of federal laws and reforms. States should, by now, have nimble systems that can readily adapt to the changes that we are facing today. Yet they don't. Many states have been left with systems that are brittle, opaque, complex, and often incomplete. It is these same systems that are now asked to change to address HR 1. And today, the same small group of vendors who show up at every RFP promising transformation and deliver at best incremental change are rolling out the same playbook again. It's been estimated that large legacy vendors will earn more than $1 billion through HR 1 implementation. There are very real consequences to HR 1 implementation going poorly. At the individual level, beneficiaries who fall out of Medicaid due to administrative errors, lack of understanding, inaccurate reporting, or failure to claim an exemption that they are entitled to, these people risk losing coverage and continuity of care. At the state level, responding to HR 1 in inefficient ways risks creating long backlogs that burden the state and contribute to the churn for individuals. And at the broadest scale, when significant changes happen and the government can't respond quickly, the public gets left behind. And that's when trust in government gets broken. So this is the context that we find ourselves in today. And as I said, we've seen a lot. We can see where things are headed, and we're not interested in watching that movie again. So we're responding to help break this pattern with OSCER. OSCER is an open source community engagement reporting tool. It's a sidecar app that sits alongside states' existing systems, extending their functionality to achieve HR 1 compliance. We're releasing OSCER with an Apache 2 license, allowing states to take the code, install it on their own infrastructure, take full ownership of the system without ever paying license fees. It's built on common, well-supported technologies, and the code is available on GitHub now to see, try, and evaluate. So here's how OSCER works. At application or renewal, OSCER receives client and ex parte data from the existing state system via API or batch process. It attempts to automatically certify community engagement requirements or identify exemptions based on that data. If it can, OSCER records that determination and the client needs to take no action. If it can't, OSCER will notify the client of the need to certify and send a link that will bring them to OSCER. OSCER's built-in mobile-first client community reporting experience allows clients to report their work or other qualified activities. And any caseworker review that is needed happens within OSCER. And OSCER serves as the source of truth for determination status and provides reporting back to understand case workload and outcome trends. And it shares data back to the existing system to act on the determinations, whether that's issuance or disenrollment. A focused implementation sprint will be needed, but OSCER has been designed to require the least amount of integration necessary to access data from the existing systems. That work can be done by in-house digital services teams or an external implementation partner. Obviously, Nava would love to help with that, but other firms can take and implement the code as well for states. We are currently identifying states for pilots or implementations, so if you are interested, please come speak to me. Our priority is usability for states and partners. We're prioritizing our roadmap to solve the biggest eligibility challenges first, with the least amount of integration pain possible. As the policy becomes more solidified and we work with states, we'll update the roadmap as needed. As I said, the repo and the roadmap are now public, and we're working in the open, and we hope you'll follow along. Okay, cool. So HR 1 is clearly an urgent matter. But this is the open source summit. And you may ask, why are we pursuing an open source approach for OSCER? Because big changes shouldn't mean big payouts for the same vendors who failed to deliver the last time. We're changing the equation, trying to shift dollars from overhead to outcomes, from lock-in to learning, and from closed systems to open collaboration. We want to lower cost and risk And we're calling bullshit on the exorbitant level of effort claims and high estimates that we're hearing. We're challenging licensing schemes that seem great in the short term but lock you in the long. We want to ensure that government owns their code and has full access to their data. We want everyone to consider the implications of VC funding in public systems where private equity priorities often distort incentives. By contrast, open source lets states invest where it makes sense and benefit together, creating durable, reusable technology. We're trying to help break vendor lock-in, because if you can't fire your vendor, you don't have a partnership. You have a hostage situation. And we want to help restore leverage. We want, when systems are open, states can hold vendors accountable and even replace them without starting over. That's what true performance-based contracting looks like. We see it as part of our commitment as a public benefit corporation to demonstrate better alternatives and to support the Medicaid community at this point in time. We'd love to talk to you if you're from a state agency about implementation, or if you're working with the state and are considering adopting OSCER. Come find me, I'm easy to spot, or reach out afterwards. And also, we're not only open sourcing OSCER, but we're open sourcing the whole platform that's allowing us to build it quickly. For that, I'm going to turn it over to LP.